Hi, I'm Scott Conard. I'm a family doctor. I've been in practice for 33 years. Oh my gosh. And I get to be the physician leader, I should say, of the MyHealth clinic. And I'm here with Elise Woodside, who actually runs the clinic, and she's the person who's here all day long. You know, Elise, we were talking a minute ago about how nurse practitioners have a wonderful relational mindset, and it's important to them to get to know their patients and to make sure that the patient understands what's going on. We talk about patient-centered care, and it's different than doctor-centered care. Like in the old days when I was trained in the last century, we'd run in, we'd try to get the history, physical, laboratory tests, diagnostic, figure out what's going on, hand the person the thing, and we were gone. And we had a relationship with our patients, but it was more transactional. Describe what your ideal relationship is with the people that you care for.
Right. So I love my patients. No concern is too small, and no problem or question is too big. I love the fact that when my patients come in, they ask me about my family, and I know what's going on with theirs. That personal relationship really allows me to give the highest quality care because I'm treating you as a person, not a number. That I know that your weight management or your cholesterol may have been a struggle, but we can find ways together that really help. You can ask several of the folks who have been in to see me. I truly do want to be your partner in wellness and health, and the best way to do that is to know you and what's important to you. What I think may not be what's most important to you, and I want to ensure that I'm helping you become your best version of yourself by meeting you where you are.
That's cool. One of the things that's interesting is that, like, back when I went to training, again, last century, the things that were harming people were acute things, gallbladder or heart attacks or diverticulitis. It was more infections and more acute things, and we were just starting to understand hypertension, diabetes, high cholesterol, and we only had like 10 medicines to use. Now there are thousands of medicines, and 80% of what causes people to not live a full life are chronic diseases. So in the old days, my job was to diagnose people, send them off to surgery, or do what we had to fix them. Today, we as a team need to help people understand what's going on in their body, have them be educated, have them manage it effectively. And so chronic disease is now the key, whereas acute disease used to be the key. So, as you can tell, different generations, your skill set is much more about helping people who feel fine, because hypertension, great silent killer. A third of people with diabetes don't know it. High cholesterol, like when's the last time you felt your cholesterol go up after you ate
Yes.
some butter or a steak? You don't feel these things, but they're going to shorten your life or make you miserable if you don't manage them.
Right.
So it's important to have that relationship, and it's important to teach people about their numbers, the 7 numbers, and then what they can do through lifestyle instead of just taking pills.
Right. I definitely think that medication has a place in chronic disease, but if it's something that we can handle on our own, it's always better to do things that way. It's going to have longer lasting effects. There's less likely to be side effects, and overall the quality of your life will be better. So medicine is great and it has its place, but I agree with you 100%, Dr. Conard. If you can do things just through lifestyle modification, which I'm more than happy to work with you on, do personally, that's always the best way to add years to your life.
Yeah, it's interesting that I've always believed that food is the strongest drug we put in our body, right? When we eat a meal, it stimulates all those receptors that pills, are focused on. And so food's the strongest drug, and the best medicine is exercise.
Absolutely.
So anything we can do to get your numbers under control of those things. And just know that we work together as a team. We have Anna, Edith, we have a great group of people around us, and all of us serve you. It's not just me, it's just not Elise, it's not Anna, Edith, it's all of us. And we meet you where you are to figure out what we can do for you.
And as many of you know, we do telemedicine, we do acute visits, we do chronic disease. We'll take care of your biometric forms for the incentive program here at TXU. If you have a concern, the MyHealth Clinic really wants to help you. We want to be your primary care home.
Yep, we want to add years to your life and life to your years by empowering you to take control of your health.